Hi there, it's Laura Dancroft from PathToHealthAndHealing.com. Today I want to talk to you about what to do if you've been diagnosed with Hashimoto's. And before I go into that, just let me give my loving disclaimer that the information I'm about to share with you is for information and educational purposes only, and it is not a replacement from seeking appropriate medical care from your health practitioner. So, you've been diagnosed with Hashimoto's and you have some options. The first option is some practitioners will make the decision or recommendation to put you on Synthroid or levothyroxine, which is your free T4. So T4 has to convert to T3 in the body. Some people do not convert this effectively for various reasons. And I talked in my last video about what Hashimoto's is and what can cause Hashimoto's. So if you haven't seen that, be sure and review that as well, because that will provide you some additional information on what are the possible causes or things that contribute to Hashimoto's. And as a functional medicine nurse practitioner, I'm going to look at all of these root cause issues, because in treating Hashimoto's, it's not about just giving you a medication. It's about understanding what are those root causes and what can we do to either reverse some of those issues that are contributing to your elevated antibodies in Hashimoto's, and also what we can do to optimize your health as well. So I may recommend something such as Synthroid, but in other times I'm going to be talking to you about lifestyle and food sensitivities and looking at your gut health and your adrenal function and looking for underlying infections. That's one of the first things I'm going to do, because doing that alone may help bring down those antibodies. Gluten and dairy are big contributors to inflammation in the body, and if you have inflammation, you're more likely than not going to have elevated antibodies. But let's say you're at the point where the thyroid function is not optimal in spite of trying to do these things. So then what do we do to try to treat that if we need some form of replacement therapy? Certainly Synthroid or levothyroxine is one option. That's your T4. But then, as I mentioned, we rely on the body to convert that to T3. Another option is using glandular thyroid. This naturally will contain T3 and T4 in it, and some people do very well with that. Some people will react to that and see their antibodies go up. Others, their antibodies will go down. So it's really kind of trial and error. And in a rare instance, I may have to actually compound thyroid hormone using a compounding pharmacy. Another approach, aside from optimizing your nutrition, your digestive enzymes, supporting your adrenal and liver function, is if a person has elevated antibodies, occasionally I will put them on something called low-dose naltrexone. So low-dose naltrexone is basically Narcan at a higher dose we use to reverse drug overdoses, but it's been found at a very small dose it can help the immune system deal with a whole host of things. This was originally discovered in the early 80s by a Dr. Bahari, who was actually treating patients with HIV and AIDS. And I have seen in some people, probably 50% in my personal experience, that will see a reduction in their thyroid antibodies with the aid of low-dose naltrexone as well. So there are a lot of different options to consider, and each person is an individual, and what's right for one may not be right for another, so it's important to have a thorough evaluation. If you would like more information about your thyroid health or functional medicine, be sure to visit my website, www.pathtohealthandhealing.com. Take care.